The first self-massage I propose consists of 2 self-massages and 2 stretches. The self-massages should last about 5 minutes each, and you can do them every 5 or 6 days. As for the stretches, they should take 2 to 3 minutes and can be done daily, but not the self-massages. You should allow the area to be reasonably sore or irritated the next day, and then wait for 5 or 6 days until the area returns to a more normal state. The first important thing, both for this self-massage and the next one I'll explain, is to never, ever apply it directly over the trochanter. We are going to work on the muscles that influence the trochanter, but please, never apply the massage directly over the trochanter because you might injure yourself. When the bursa becomes inflamed, it's because it's tired of being irritated. Bursae don't like being touched. They don't like massage. They don't like movement when they are inflamed. So please, I insist, don't apply the ball directly over the bursa or the trochanter. The trochanter is located on the lateral side, in that area where you feel pain when you lean on it. Now, for this self-massage, we will focus on the gluteal and piriformis area, placing the ball under the gluteal area. We are doing this on a mattress, but it might be better to do it on a mat on the floor so that the ball can sink more into your buttocks and less into the mattress. Once you have the ball in place, make a back and forth movement from left to right to work on all that muscle area. As I mentioned, this should take about 5 minutes, so you can move the ball around, placing it higher, lower, more to the outside, more to the inside, and above all, gradually work more on the lateral side. Position the ball there, slightly shift your body to the side, and make movements forward, backward, and even more to the lateral side, almost placing yourself sideways, even completely sideways with the ball there. You see, we are on the lateral side, dangerously close to the trochanter, but not on the trochanter. We are working around it. We are working on the soft tissue, on the gluteus medius, and the gluteus minimus muscles. If we work even further forward, which is advisable, we will be on the tensor fasciae latae muscle. It is essential to work on this whole area, but never on this area, which is already bone, which is hard. There is the trochanter. I insist on this because I don't want you to hurt yourself. Now, for the second self-massage, place the affected leg over the other one. This massage is for the fascia lata. Put some tension on the fascia lata and then, with your own fist, start massaging from just below the trochanter, not on the trochanter itself, but a bit below it, and massage all the way down the lateral side. It should be a deep, intense, slow massage without clothes. If you're wearing leggings, it won't work as effectively on the tissues. It has to be done without clothing. So, clench your fists and slowly, progressively, massage deeper and deeper until you reach the knee. That's the path of the fascia lata. And you will do this same self-massage for about 5 minutes. You can make many passes, targeting a bit further back, in the hamstrings area, a bit forward, in the vastus externus area, and since you have 5 minutes, you will be able to work in all directions and cover various types of passes. Now let's move on to the two stretches. The first stretch is a gluteal and piriformis stretch. As we mentioned, it should be held for 2 to 3 minutes. To do this, keep the leg that was bent, place the other leg on top, and with your hand, apply tension. The idea here is to create traction, to pull on different pelvitrocanteric muscles, not just the gluteal and piriformis muscles, but a variety of muscles. We will work in different degrees and positions of the hip. For example, we can increase the flexion of the knee, increase the hip flexion, or adjust the position to increase the pressure. You have to explore the different positions. Here, 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 here. See how we can rotate. We are pulling on different stretches, shifting inward. We are targeting different muscles, as I mentioned, including the piriformis, obturator, gemini, quadratus femoris, and gluteal muscles. We are trying to work on the overall musculature known as pelvitrocanteric, which relates to the pelvis and the trochanter in trochanteritis. The last stretch we will do is the opening chain stretch. In reality, we are primarily stretching the fascia lata. For this, we have this band here. It could be a band, a belt, a towel, or a sheet, whatever you have at home. Place it on the tip of your foot and pull mainly on the outer side to create an eversion of the foot. It's like a position of a flat foot, and we will try to flatten the foot and the leg, then move it inward, tensing all the lateral musculature. I would even say that the knee should be slightly bent and rotated inward, an internal rotation of the knee. This way, we are pulling on all the lateral musculature that we also call the opening chain. It's the musculature that later rubs against the trochanter. Therefore, we are trying to release tension. Great! These two self-massages and two stretches will help alleviate pressure, friction on the trochanter, and, therefore, relieve the symptoms.